There is a call for more Jamaicans to do screening for sickle cell disease. This is because the earlier treatment starts, the better the outcome. Shamela Pullen tells us more in the health report.
Each year, roughly 250 babies are born in Jamaica with sickle cell disease. Director of the Sickle Cell Unit at the University of the West Indies, UWI, Professor Jennifer Knight Madden, says sickle cell disease is genetic.
It's called sickle cell disease because the red cells are sickle shaped instead of the usual red shape. The sickle shape, we'll probably have called it banana cell disease. They stick together, they block the blood vessels. They're very rigid. They can't go through the blood vessels like normal red cells do. And that leads to a lot of the problems. They break down easily, so people are anemic, and they block the blood vessels, and so people get trouble.
Which is why parents are advised to check for early signs. One main sign includes the spleen. This is an organ in the upper part of a child's belly. Other parts of the body to check for pain are the fingers and toes.
You have acute pain, and as adults get older, sometimes they have chronic pain. So pain is a big part of sickle cell disease. But what people see, yellow eyes, jaundice, pale mucous membranes, and maybe leg ulcers, so they can get ulcers on their lower limbs, around the ankles, that are very distressing.
Professor Knight Madden says 15% of the adult population could have sickle cell disease and not know it. It's why screening is important.
Just do a simple blood test, but not just a sickle test. We want to know if you have S or C or any of the others. So you ask for electrophoresis, and that will tell you. So know your status, that of your partner, no, or any potential partner that you may be thinking of, and know the status of your children.
But sickle cell disease is not a death sentence. With advances in medicine and technology over the years, persons are better able to access treatment.
Hydroxyurea is now available. It's one of the drugs covered by the National Health Fund. There's a subsidy there. And most patients who go on that find that their experience in terms of painful crisis, of acute chest pneumonia, and those things actually decrease. So we're trying to encourage more and more people to go on hydroxyurea.
There are other newer treatments, including a bone marrow transplant, but those are not widely available in Jamaica. With your health report, I'm Shamela Pullen, wishing you good health.